Let's look into the impact of alcohol on the brain and body. Alcohol affects the human body in many different ways. There are acute and chronic responses to alcohol consumption, meaning the short-term effects that happen soon after drinking and the long-term effects that develop with repeated use over time. Alcohol also has significant impacts on mental health. It affects different parts of the brain and alters normal brain function. We will also look into how alcohol also has an effect on body weight, including how it can influence appetite, metabolism, and overall energy balance. Alcohol affects the nervous system in both short-term and long-term ways. It depresses the central nervous system by increasing inhibitory GABA activity and reducing excitatory glutamate signaling. As a result, brain activity slows, which impairs coordination, reaction time, and judgment. Repeated alcohol use also overstimulates the brain's reward system. This increases dopamine-based reinforcement, making drinking feel rewarding and raising the risk of dependence and behavioral changes over time. Alcohol metabolism also produces acetaldehyde and free radicals, which can damage mitochondria and brain cells and may contribute to brain shrinkage. In addition, chronic alcohol exposure promotes neuroinflammation and blood-brain barrier injury. Together, these changes worsen neuronal damage and can contribute to long-term cognitive decline. Alcohol consumption negatively impacts the gut-brain axis, which alters mental health states. Chronic alcohol consumption leads to malnutrition as ethanol interferes with the small intestine's ability to absorb vital nutrients. It also impairs intestinal functioning at the cellular level for the transportation of nutrients throughout the body. The gut lining is also seen to be damaged. Therefore, the resulting lack of gut health leads to mental health problems as lack of nutrients impairs production of neurotransmitters, and the damaged gut lining can lead to toxins entering into the brain causing depression and brain fog. Alcohol also has the potential to affect mental health due to it being a central nervous system depressant, which can be short-term and/or long-term. Some short-term effects include mood swings, increased irritability, and impaired judgment, which tend to go away once alcohol leaves the body. More concerning, long-term effects include depression, anxiety, cognitive decline, memory blackout, and dependency when used heavily over time. When alcohol use becomes chronic, there is the potential of irreversible neurological damage. When looking at the effects of alcohol and anxiety, there is a large correlation between individuals with social anxiety and pre-drinking before a social event. People who experience social anxiety in their daily lives may feel extra nervous before going out, which may urge them to drink prior to the event to take the edge off. Anticipatory anxiety is a trigger for this behavior, and is mainly a problem when this drinking occurs alone. Pre-drinking also leads to drinking more throughout the night, which could lead to more long-term mental health effects. Besides just anxiety, depression is also a major repercussion of heavy drinking. There is a strong correlation between alcohol abuse and depressive symptoms, and studies have found that the presence of either disorder almost doubles the risk of the other. Along with this, the risk of suicidal tendencies increases exponentially when depression and alcohol abuse disorders co-occur. Sadly, suicidal individuals with alcohol disorders tend to be more reluctant to seek help for their depressive symptoms, and have trouble finding support. Overall, there are many risks of alcohol on mental health, and these risks have the potential to be lifelong, or possibly fatal. Alcohol's effect on the body has been widely studied for decades, and we have found alcohol interacts with organs all over your body as it is water-soluble and easily diffuses into body cells. Alcohol consumption's effect on your body depends on several factors including body water content, sex, age, metabolic rate and tolerance. An important factor being tolerance is built up through repeated use of alcohol. Chronic alcohol consumption alters the absorption of nutrients within the body, suppressing the immune system. Alcohol weakens vital immune cells such as macrophages and T cells, while also triggering chronic inflammation that is going to disrupt normal immune balance. It reduces absorption of vitamins A, C, and D, and allows toxins and bacteria to enter the bloodstream, provoking harmful immune responses. The immune dysfunction increases the risk of liver disease, lung infection, and neuroinflammation. Maintaining a healthy and diverse gut microbiome may reduce some of the adverse effects of alcohol on the immune system. For example, maintaining a healthy and diverse gut microbiome through diets rich in prebiotics, fruits, and vegetables supports immune and metabolic balance, and helps protect against inflammation seen to be caused by chronic alcohol consumption. Healthy gut microbiome can help buffer some of the harmful immune effects associated with alcohol consumption. Acute alcohol consumption will cause vasodilation of your blood vessels and increase blood flow as well as suppress your immune system. With increased blood flow comes stress to the heart as well as inflammation to several organ systems as they deal with increased workload of the blood flow and activity brought about by reduced inhibition. These initial inflammation may develop into acute respiratory distress syndrome, acute myopathy, acute pancreatitis and slowly damage the liver. All in all, chronic alcohol consumption will worsen existing conditions through chronic inflammation of the organs which kills the organ cells. Some chronic conditions include cardiac arrhythmia, chronic hypertension, chronic pancreatitis, colon cancer, liver cancer, cirrhosis of the liver and alcohol-related hepatitis, not to mention slow irreversible neuron death to alcohol poisoning. Alcohol can also affect body weight and metabolism in several ways. First, it provides about 7 calories per gram, which makes it almost as calorie-dense as fat. But unlike whole foods, those calories offer very little nutritional value, so they are considered empty calories. Many alcoholic drinks also contain added sugars from mixers, which increases the calorie content even more. These calories are often additive, meaning people usually drink them on top of the food they already eat instead of replacing food calories. Over time, by simply consuming more calories than the body burns, this can lead to a positive energy balance, which may contribute to weight gain. Alcohol can also affect appetite and food choice. It can disrupt normal hunger and fullness signals. Normally, ghrelin increases hunger whereas hormones like leptin, GLP-1, and PYY help in promoting satiety. Alcohol can disrupt this equilibrium by making high-fat, high-sugar foods more enticing, decreasing feelings of fullness, and raising appetite. Alcohol may also activate reward pathways in the brain that increase food motivation. This can make it easier to overeat, especially high-calorie foods. Finally, alcohol has an effect on metabolism. It can interfere with fat oxidation, which means the body may burn less fat and store more of it instead. It can also reduce nutrient absorption. Overall, alcohol can disrupt body function in many different ways. It has multiple effects on the brain, body, metabolism, and mental health. It disrupts normal brain signaling, affects reward and appetite pathways, interferes with nutrient absorption, and over time can contribute to inflammation, organ damage, weight gain, and other long-term health problems. That's why it's important to understand its effects not just as a drink, but as something that can influence overall health over time.